Psych wards are supposed to be a place where people get help for various disorders and dysfunctions. But on the other end, psychiatrists, insurance companies, and of course, Big Pharma have much to gain from the dysfunctions and misfortunes of others. People that have had minor encounters in wards may not experience the tight grip of the psych industry that turns patients into lifelong customers, but keeping patients dependent on these psychiatric institutions is the life's blood of these entities. And they are quite successful at doing this without the patient detecting anything out of the ordinary. During my time in the ward as a worker, I sat in on many psychiatric evaluations where the patient and psychiatrist would go back and forth about treatment plans, updates and medications, and other patient concerns. The first thing that made me uncomfortable was how the psychiatrist would often spend less than 5 minutes with each patient and yet have in-depth diagnoses ready, often with very large amounts of medication involved. Most patients trust a doctor as an authority figure that wouldn't do them any harm. Doctors have an incredible amount of authority in Western society and are usually sought out as the final say-so for most matters, which ideally isn't wrong, unless, of course, a doctor can have ulterior motives. By asking questions a part of the job to psychiatrists and nurses, I was able to find out how some of the medication combinations can create unique side effects that can often exacerbate a patient's symptoms or mental state, furthering their need for treatment. This usually leads to them being prescribed more medication, which means the psychiatrists can keep billing the insurance companies. Meanwhile, the hospitals, insurance companies, and psychiatrists, and most of all, Big Pharma, can keep lining their pockets. But what happens when a patient is affected by psych meds to the point where they require abnormal medical attention, or worse, if they lose their life? Throughout my years as a worker, I've seen both, and rarely are the causes of hospitalization or patient expiration ever linked back to their care in the ward in any way. Coincidence? You be the judge. I'm just a messenger. Additionally, it is within normal scope of practice for psychiatrists to try and squeeze an extra dime out of patients using something I call the MedShift method. Insurance companies will stop covering a patient's psych visit if they don't see changes from the psychiatrist in the treatment plan. And that means the hospital and the psychiatrist are no longer getting paid for that patient. So a simple shift in medication dosage can justify the insurance companies paying for additional days. And the doctor can just tell the patient that due to a change in meds, they need to be monitored for an extra couple days or so, which patients usually aren't a fan of, but hey, doctor's orders, right? But if the doctor can't get more days allotted by the insurance company, the pressure is put on the nurses and discharge department to get these patients out as soon as possible. This means even if the patient isn't fully functional or recovered, they can be discharged. And with a high amount of psych patients living on the streets, they are discharged to homeless shelters, or if they're lucky enough, a group home, which can be very dangerous places to live for many reasons. Not to mention, the group home business is yet another place where patients are seen as cash cows and can be taken advantage of and manipulated. But we don't have time to cover that in this video, perhaps another one, so let me know if you want me to cover it. These are examples of how patient care comes second to the dollar in a way that most people would never notice. It should be noted that this is an issue across our healthcare system in the U.S. And staff have no idea they are just batteries for a bigger machine. And even though there are exceptional people and workers in this field, no one under their own power can invoke the systematic change that needs to happen from the very top, starting with Big Pharma, in order for people to get the full help they require. Let me know your thoughts about this in the comments and follow for more.